All right, so let's call the meeting to order. How about that? Let's start there.
All right, let me start with the oh my goodness, the virtual meeting statement. So pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, chapter 30A, subsection 18, and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. Thus, the meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with the right and or requirement to attend this meeting can be found at www.hubbardstonma.us. No in-person attendance of the members of the public will be permitted, but every effort will be made to ensure that public can adequately access the proceedings in real time via technological means. In the event we are unable to do so, despite best efforts, we'll post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible. So with that being said, this is being recorded. Kate, we have a couple of members in the audience. One of them is for new business, which is our CAP solution in the WELL program. So we have Jim here to give a short presentation. I don't know if we want to reorder to let him go first.
Yes, let's reorder and have RCAP Solutions go first, and then we'll go from there.
Him.
Okay, let me start the video too. I didn't know how this worked. I'm sorry, work on this end. Well, thank you for the opportunity to meet with you tonight. The Private Well program is funded by the Health Foundation of Central Massachusetts, and then we're in our second year. We sent out notifications last year about the program and really did it in a broad branch of all the 25 towns. This year is a pilot year. It's a second year of a 5-year grant. This year is what's called a pilot year, and we're concentrating on 6 towns within Central Mass, Northern Central Mass, and Hubbardston is one of them. The program is really looking towards to promote private wells, to educate the homeowners, and also work with boards of health that would like to possibly tighten up any regulations they might have or any other ways they keep track of the private wells. Locally, we'd be doing educational for the private well owners because we will be offering 40 well assessments with sampling. The well assessment is like almost like a sanitary survey. It's an in-depth look at the well, meeting with the homeowner, look at the well and septic records for the area, any other information we could possibly get, and then with that well sampling information, send the homeowner a full report on their well, anything that they should look out for, corrections they should make. If the sampling found any issues, we'd also give them recommendations of what kind of treatment to do and how to pursue that. We wouldn't be making recommendations on what kind of filter to get or what company to go with. We would just make broad-based generalization and try to give them the best knowledge to make that decision themselves. Knowing that we can't get to every well, we also hope to do a public education component to it. Right now we have a website set up just for this program and has 3 steps for better water quality, basically what to test for, where to bring the test, and how to interpret those results. But we're also hoping to get other educational information out there. When this program first started, we were hoping to have actual written materials in town halls and libraries, etc. Hoping to still do that as the pandemic slows down and people are actually going to public venues, etc. But and then the third one, like I mentioned, we're looking at private well regulations. The long-term goal of this project and the 5-year goal of it is to really standardize private well regulations in the Commonwealth, like any other health code that the Board of Health is responsible for, like the food code, Title V, swimming pools, you name it, all comes from the state. And the local Board of Health can be more stringent, but not less stringent. Private wells seems to be that area that was kind of left out with that. So we're really hoping to work with boards of health that are willing and wanted to implement stronger regulations if they needed be. And we're really looking at the model regulations that Mass DEP put on 2019 as the model at the local level, and kind of really to get almost a momentum going, kind of like the smoking regulations that came through boards of health, local boards of health, first banned indoor tobacco use, and the local boards of health went forward 21 plus, and this year it became a state standard. It's almost using that model to move the regulations forward. We have a leadership team with members, Montechusett Public Health Network, Steve Curry sits on it, as well as the Neshoba Associated Boards of Health. Those are the two target regions. Also Mass Environmental Health, Mass DP. Mass DP also sits on for Mass DPH. Mass DP and DPH are kind of working in conjunction together on this, kind of jurisdiction-wise, who's responsible for what, etc. So that's kind of the program in a nutshell, if you will. We are working on marketing materials to try to get out to the homeowners. We do have some homeowners from last year that requested the well assessment and testing. We still have their information. We're going to be reaching out to them first as one of those top 40. But once that materials are ready, we really like the town's assistance in getting that word out. Yeah, and I guess I could open up to questions from you if you had any questions. I did wanted to see if it's possible if I could get the private well regulations, if there is any Hubbardston. Well, we've been doing an online search, if you will, and I didn't see them on the town website, so I didn't know if it's possible to get your pre-existing regulations forwarded at a later date.
I don't think we have any specific to the town, none that I've seen.
Yeah, we do.
We do?
We do, because we have that's why I've been asking, do we have a copy of our, because we do have Board of Health regulations, and they do address the wells and everything like that. So we really need to find a copy. I had a copy, and I've been hunting all around the house looking for it. But we did at one point, we had Board of Health regulations that address noise and water and all kinds of stuff. And a lot of them were much like Jim just said, a lot of them were tighter than what the state required. When a well goes in, we require a full, I remember just what I'm just going by memory, but when any kind of well went in, a replacement well or whatever, first time well, we required complete and full testing for everything. And then after the well had been functioning for a while, there was a second test that was also required. And then that's when filtration systems and everything else were all put in, were based on those two tests. So my question to Jim is, why Hubbardston?
We were literally looking for towns that were primarily use private wells, which Hubbardston is all, other than the public water systems are self-contained. We actually manage the Hubbardston House Apartments, which is a self-contained public water system. It's on its own well, but it is regulated under Mass DEP as a public water system. So out of the six, definitely, and we had good interest too when we did last year's outreach from the homeowners. So between those two was a good fit, if you will. The region itself was picked due to the high presence of arsenic, uranium, and radon. So originally, when we proposed this, from USGS mapping, they already knew that this was a high prevalence area. So all those three contaminants plus a full suite will be included in what we do. Other than PFAS, I know you're also a Mass DEP PFAS community. So we're also making sure in our materials that it's clear that this program is separate from the Mass DEPs, because out of the 6 communities we're working with, 5 also are going to be doing the PFAS sampling in private wells too. So we're trying to keep that separate, and we have our communications with the Mass DEP central office too about how to keep that separate.
Predominantly, mostly we have like minerals like manganese and stuff like that. That's the biggest problem, because that's why people start putting in, because of the mineral content, that's why people start putting in the salts and everything else. People put in filtration systems. Arsenic and radon, I don't know, my memory serves me, that was much less of a problem.
We were going by the mapping,
Yeah.
and then, you know, we brought in the public health regions per se. So I'm not saying every town, you know, had that prevalence, but it was a great streak. All of Central Mass is considered the highest air radon, so we just kind of went with that with the water radon as well. If it's in the air, it's probably in the water too.
So it's less about income and home ownership and versus rent and less of an income than it's more about the groundwater than it really is about other factors.
Yeah, it was more about, well, water quality and public health, and demographics, income really weren't put into the equation.
Okay.
They
I'll
are in
shut up now.
other of our programs, but this was looking, you know, we're trying to get a model for a statewide thing, so it wasn't the goal, if you will.
Well, I'll shut up now.
Judy, do you remember like how many years ago, or who else would have been on the board that might have a copy of those regulations?
That
Tom
would have,
Larson might have a copy.
Larson. Okay.
Yeah, we gotta reach out to him. I have to go back through my old regs from when I started to see what I have.
Yeah, I haven't seen them, and I can't tell you the last time they've been enforced.
General bylaws have a section on the Board of Health, but it gets fragmented and I'll look it up later. It gets fragmented and it ends up under public safety, although it's designated as a Board of Health. And I think that's where those are located. And I also
the
think
whole
that
book.
we also have the regulations for building permits requiring 2 well tests, like Judy said. First one, you have to have a well in place and tested before you even get your building permit. And before you can get your occupancy permit, you have to have a complete file of testing, making sure it's not only clean and potable, but you know, what the levels are reported. Question I have is, who gets these results from people's wells? And does it just come to the Board of Health, or is it going to be some kind of organization that's going to get it? It's going to then start calling people and putting
Yeah, no, it'd be
all
between.
this stuff?
They were hoping to make it public to the Board of Health, but on a less specific way, for you not knowing it's Johnny's house. It's, you know, this neighborhood has this neighborhood has that. The homeowner itself will get the results in all, you know, and all that. But we're trying to keep it that it's not public to the world what the results are, if you will. You know, we want to use that information, but we don't want to, you know, incriminate, if you will. You know?
So if you come across something that is like severe or drastic that needs to be addressed like ASAP, would we then get the results with the address so that we can, you know, help the homeowner and steer them in the right direction?
Well, part of this would be that we would, you know, if say I did a well test, and this happened actually last year, and E. coli was positive.
Yeah.
The lab notified me within 24 hours. It's their practice that as soon as they do the coliform, it turns over in 24 hours. Would be either total coliform or E. coli, which they automatically do if it's total coliform positive. They notify me. I call the homeowner that did the test immediately and advise them. If it's E. coli, I advise them, you know, either boil it or don't drink it. If it's total coliform, we also advise too to do a resample just to make sure. But if it's total coliform, you know, we advise them to maybe do a less stringent policy, but, you know, at least retest and bleach the well. Hopefully during the well assessment too, the site assessment, we saw something that might contribute to it. It wasn't in Hubbardston, it was in Royalston actually that we found the E. coli issue, and turned out it was a dug well underneath the ground and the septic tank was 50 feet from. So that was an easy one to kind of pinpoint.
All right, thank you.
And I should mention too, I'm a former health inspector myself. I worked in Framingham and Marlboro. I'm a registered sanitarian, certified health officer, Title V inspector, all that, and a water operator. So I'll be giving them sound advice, and the advice we give them will be based on Mass DEP and our EPA guidance, and won't be, something we pull out of the sky. We do use some technical stuff, a lot from Connecticut DPH. They have some great one pages on different topics that we would send out as resources, but that's the kind of stuff we would be forwarding the homeowners, credible sources, mostly from a state or federal agency, if you will.
So basically, like, our biggest role in this would just be getting those marketing materials out there for you and trying to draw in some
Yeah,
applicants.
and like I said, and anything we could help you with getting word out there, or if you wanted to do anything with, the regulations or any kind of outreach or something like that, we'd be happy to work
Okay.
with you too.
Awesome.
One of the people on our leadership team is the gentleman actually wrote the private well model regulations for Mass DEP, Joe Cerruti. So, we trying to bring a good team of people together with a lot of different knowledge. We also have a couple professors, one from Northeastern University with a lot of water knowledge, and the gentleman that runs the private well class out of University of Illinois, the former president of the real estate association of the state. So trying to get the real estate agents on board. So trying to get a comprehensive group together. There's state reps and state legislators and senators that are on our team too, as well as federal too. So we're trying to kind of bring everyone to the table and trying to push this forward, if you will. And like I said, we're trying to work with the communities first with a long-term goal of a statewide minimum standard. So you wouldn't have to worry about what the regulations are, where they are, because you would already have a minimum standard, just like the food code. And if you want to be more stringent, great. If you don't, great. Yeah.
I like that.
So given that,
Would you send us a
go ahead.
website? Would you send the website information to Mallory so she can send it to us?
Sure. Will
It's
do.
on the document that Mallory attached to the meeting at the very bottom.
It is? Okay. I didn't get that far.
No
Sorry.
worries. There's
And then
a
we're
lot of documents.
And like I mentioned, we finish up the marketing materials now. We've got some input from their partners, so we're just should have those out probably by this week to you as well.
Awesome.
And so my question was around regulation. So, and I think you've covered this in what you just stated, but at the end of the day, the one action item I heard is that we need to dig up our regulations and send you a copy, which I think we'd be happy to do. And then after this is done, or during the process of this, I think it would be great if we could review those recommendations, like whatever findings you have against our regulations, to see if there are gaps we can close, or remodel those regulations and bring them up to current if they're out of date. So I think I heard that as one of the side effects of this, was that we could kind of revamp our regulations and bring them into current status, right?
Right.
Yeah, and then that would be, that's just totally up to you as the board. We're here to help, but if it's not something you want to pursue, that's fine too. It's totally the Tom's prerogative.
Okay.
I have a question. Can you
Sure.
guys hear me? Can you hear me now?
Yep.
Yeah.
Okay, good. I'm on my other computer. Just a question, because I wasn't here when you started speaking.
Sure.
It says in your letter that you wanted to do 40 wells. I don't know if you already went through this or not, but is that like some kind of a number that you're going for? What happens if you don't get even close to 40 wells in town?
Well, that's what our game plan is. Out of the 6 communities, do 40 in each ones for a total of 240 samples this year. And then 6 other communities for the next 3 years, so we're bringing up to about 1,000 samples. So that's the goal. Where we're still going with that plan. I guess if it doesn't work out, I mean, I would like to think that it would. We're up in a free service, over a couple of $100 in value. So.
Well, I guess I mean, if you say you got like 20 or 15 in town, would you still continue with this in Hubbardston, or would you just say, well, it's not enough?
Oh, no, we would continue. I mean, we're committed to the 6 communities this time, 3 in the Montechusett Health District area, 3 in the Neshoba. And that's kind of our game plan moving forward. So both health district and network, have
Okay, no, I didn't know if that was discussed before I came back on, so. Thank
I
you.
will say, last year we had a limited number and we've received probably over 120 more requests than we could fulfill last year. Not just in Hubbardston, out of the 25 communities. So we feel it's pretty good. I'm not sure if the PFOS.
Oops. Froze.
Frozen.
Give Jim a minute to maybe unfreeze. While Jim's
Yes.
frozen. So next steps from the board on this would be a vote to move forward.
Does anybody know how much it costs for now? I know back then it was $250 for a complete test. What is the cost now? Does anybody know?
Do not-
I have no idea.
For a well water test,
Yeah, the complete well water test with all the minerals and everything.
I pay $125 at Neshoba Analytical every year.
Because when I thought it was like around 250.
Not at Neshoba Analytical.
Is that a water test, Kathy, or do they come and inspect the well?
It's water test.
Yeah,
Yeah,
these
so
would be
a
bigger.
well test is a little more comprehensive. I think it would probably be more than that.
Right.
The national average, Judy, is $300 to $500.
That's what I thought. Yeah. Okay.
Sorry, I misunderstood which test you were referring to.
There's
No
so many. Yeah, because we just require the water test for like food permits, but they're going bigger and deeper with this test to
Yeah.
take a look at the actual well itself.
Yeah, I can't imagine we wouldn't find 40 people to sign up. I mean, hell, I would sign up.
Everyone in town is on a well except for those public sources. so
Exactly.
we
We had
went-
ours done when we moved in. We paid for additional testing on our own because I'm that person. So
That's the way it should be. I mean, if we're going to sell a house, then we need to be sure the water is pure before somebody else moves in. So I think, that's something that we could tighten up real fast.
yeah,
And I don't know if Jim's coming back or not, Kate, but we also have for reopening and meetings in person, which is after the minutes, we have some members of the senior center online with us too. So I don't know if you just want to jump right into that.
I think
We
can.
haven't reviewed the plan first. Don't we need to do that first? That
Yeah. The under COVID is to review the opening plan and then in-person meetings.
Yeah.
Jim's not hopping back on, so I don't
Okay.
know how long we
We
want to
can-
give him or.
Yeah. Was it 58? I don't know. Give him one more minute. Maybe he lost internet. Why don't we look at the reopening plan so we can reorganize after he rejoins? I've reviewed the reopening plan. I don't really have any super big questions. It lays out pretty,
Yeah,
Yeah,
David,
I read it too, and it's, sounds good.
David Nixon, he's the one who wrote it, and he based it off of the plan from Hadley that he helped write there with the Board of Health's help over there too. So he's not reinventing any wheel with his.
That's the way it came across to me, was we're not inventing any wheels.
Yeah, it sounds the same as everything else you've been hearing constantly, so.
Yeah.
Like Kate said, nothing jumps out, I mean, that's different or
Oh, Jim's back.
could be questionable.
I wondered if it would be helpful to the various committees if there were like a bullet point list of that somehow to highlight, the various parts that they really need to focus on with the details. I just thought it was long and wordy in a way, but it is complete and it's good. I'm not saying it's not. I didn't know if there was some way of making a outline or something for people to look to go with it, just to make it easier for them. Okay, I need to check such and such. I'll find it in this section or something like that. That's the only thought I had. Otherwise, it's fine to me.
Oh, Jim is back. So sorry, Jim, we kind of moved on. We didn't know if you were gonna be able to jump in on again.
Yeah, I apologize. We've been having internet problems today. I had to try to reboot it before I got on this meeting, and didn't look like it worked. So I guess I'll be calling them back to get a technician.
Welcome to
Alright.
2020, 21.
Yeah.
I don't know if anyone else on the board had any more questions or not.
I don't think so. I did not. Anyone else?
I'm comfortable.
I'm all set.
All right.
All set.
And because I'm the worst at all rules of order, do we need to vote on this, Mel? And a motion, or this is just yeah, we're good.
Yeah, I think we're good. We all agree that we'll help promote it and help Jim get whatever he needs. I'll search for those regulations some more and try to see if I can't track down a previous Board of Health member who still might be holding on to them, because we don't have any record in the office right now. At least from the bins I've gone through, and there's nothing on the computer, so I'll try to find them.
Yeah, I'll be happy to send over the what Mass DEP wrote up for a model regulation. They just redid them in 2019, so I'll be happy to send it over too.
Awesome.
I think we're
Thank you so
good.
much for coming.
Okay, thank you very much.
Looking forward to it. Thank you.
I'm gonna have to excuse myself for a few minutes and take that phone call, so I'll be right back.
Sure.
Well, how do I do that?
Yeah,
Well,
I would
first-
just put yourself on mute and take your camera off.
Yeah, you hit stop video and
There
mute.
you go. Okay.
So I think, Kathy, that as our phases of reopening kind of going to follow the state's reopening plan too that they've put forth.
Right.
So I think a lot of those one pagers will be able to come from CDC and Mass DPH as they,
Okay,
so I think we'll be good there.
okay. Long
but
as
I think-
everyone knows that, I think
Yeah.
that they should be, that we need to let them all know that they need to see those come out before
Yeah.
they step forward with something.
So I don't know if it's a good idea or not that we kind of implement maybe like a signature page. Yes, I received this opening plan. I read it. We're gonna abide by it.
Yes,
If that's a good idea or not.
For
Yes.
each department or for each group,
Everyone, each committee and each department.
I think that'd be a great idea.
I think it's an excellent idea.
That was my thought on it, because you know how many emails we get and how quick it is to skim something over and then to miss it, and then
Yep.
we get that, oh, I didn't know, and it was there in clear writing. So
And do you have access to DocuSign so you can send it?
I do.
Perfect.
Yeah.
Let's do it that way.
Okay. I can get that. I'll send it over, and you can all take a look at what I put together and see if I need something or if I don't need something. Or I just think that before we implement this, if we can get a sign off from everyone. I mean, once you're a department head, you're in charge of that department. So, fire, police, DPW,
Yes.
go from there. All the committees, chairs can sign, I guess.
Okay.
And then just ask that it be made an agenda item on everyone's upcoming meetings to review with members. Is my thought.
So
I like
make a
having-
motion
Oh,
that
go
we
ahead.
adopt our TW document with DocuSign by each committee or board, and that they also document that they have reviewed it with all the members of their group.
And that's easy enough. DocuSign's just a click in.
All right. I will second that motion. Let's take a vote. Judy,
That's fine.
Colleen,
I'm okay with that.
Kathy,
Yes,
and Kate is a yes. So the motion passes.
So then I guess our next item of business is our in-person meetings and opening up services like the senior center and how we want to move forward with that. I know a lot of senior centers are starting to reopen and offer the services that with the social distancing and all the safety protocols in place. And we do have a couple folks from the senior center. I'm going to just promote them on
Sure.
to talk they can.
yep.
So we have Nancy, we have Mel, and we have Claudia on the line too, and they're all members. Claudia is the Council on Aging Director, and then Nancy and Mel both volunteer there. I don't know if they have other titles, so I apologize for not knowing that. I don't know if you guys want to say anything or if we're just here to listen.
Well, we know you're anxious to get back and give seniors connectivity. And I think that now that we have the approved plan, you can go over that. You know, each of the board members on the senior center can go through that. I don't anticipate a problem with reopening the senior center, especially we have some really nice weather where you can do some of it outside again. So again, it's as long as everyone is masking and following the rules, even if they're vaccinated, I don't see a problem with them restarting myself.
And then the same with meetings. Do we want to take that with the meetings as well, or we know where we can offer the, if you feel comfortable doing hybrid, do hybrid. If you feel comfortable, most comfortable with Zoom, continue with Zoom. I don't know how you want to do your takes on that. We have a lot of boards looking to meet in person again.
I would say that, I mean, my personal approach would be to always offer hybrid, or at least for the foreseeable future until we're fully in new normal across the state and across the town. And the offer of hybrid specifically because I think it gives somebody an opportunity to still attend from the public, even if they have a fever, they're not feeling well, and you don't risk somebody saying, well, I really need to be here, right? There's no rush to be anywhere because you can always attend via Zoom and, you know, participate that way.
Yeah.
So in my mind, I think having the boards offer a hybrid approach, even if they're having an in-person meeting, is going to be the best public safety measure, right? Like to just keep that open, keep that channel open, keep those practices up. And then when we're fully in new normal and, you know, this is a regular booster shot and, you know, it becomes nothing but the flu essentially, then full in-person meetings, no need for Zoom. I don't know how the rest of the board feels about it, but that's my own personal take.
I agree with you, Kate.
I think, I mean, I cover quite a few boards, and I think that like just sitting on these meetings, we miss a lot. As like not the integrity of the board, but it just happens. You miss. It's a lot easier to have the discussion and have the papers in front of you and to be looking at the plans, not on a computer screen. So we're missing a lot of that, and which is so important in public government. So I think that offering the opportunity for the boards to get together, to do those signatures, to review the plans, and not just on a computer screen, it's huge. So
yep, I agree.
They could.
But I also think that
giving the opportunity, like Kate said, to have other people around town participate via Zoom, maybe because they're sick, maybe because they shouldn't be dragging kids along with them to the meetings to make their points. By having in-person with the hybrid Zoom option gives everyone a better chance of participating in and making their statements and so on.
Right. So I know the Board of Assessors did this where they just met with the board and then they Zoomed to the public, which worked out for them. So I think it's possible.
Right. And I'm not saying
we don't have to let the public come in yet. It can just be the hybrid with the option for the board members and the clerk only for now. And then everyone else participates via Zoom. Because, you know, some of the upcoming topics that we have are like the site plans and special permits are going to draw a crowd. So maybe for now we say we just try the boards only and then public Zoom and then see how that goes and go from there.
I'd be fine with that. I do think that even, you know, in steps beyond, I think hybrid should be encouraged for a lot of reasons, but yeah, I'd be fine with that. Judy or Colleen?
I'm fine with that, Kate.
I'm fine with that too.
Yeah, I don't have any comments.
Okay, so that's our plan of action.
Yeah, so we'll allow for the boards to meet and then public Zoom. So I can put together some documents with Lori on that because she's our Zoom person. So if anyone has questions on how to post it or anything like that, Lori and I can get it all together for people.
And Mel or Nancy or Claudia, do any of you have any questions? Are they
They were all
connected?
muted. I don't know if anybody had, everybody's muted there, so.
Yeah, I don't have any hands up or anything like that either. Did you hear that, Claudia?
Can you hear me now?
Yes,
Yes,
Can you hear me now?
there you
Yep.
are.
we got you.
Hello?
We can hear you.
Oh, could you hear?
Hi, Mel.
Hi there. So we have a meeting scheduled for tomorrow. Does that mean we can do that in person?
Probably not because it's not the posted. You need to post it correctly. So tomorrow will probably have to be Zoom.
Well, I think Laurie, can you hear me?
I can
Yep.
hear you.
Yeah, I think Laurie kind of left that open.
Oh, she did. Okay.
I think she did because we talked about that.
Are you prepared to Zoom the meeting?
But we don't know how, see, now that's the thing is you're dealing with seniors, so I don't know
I think it is
how to
set
do
up.
that. I mean, we would meet in person and then Zoom it also.
Yeah. you
Yes,
have
so
to,
that the
like,
public
Yeah,
can
so
come in.
who would set that up?
Well, you'd have to have a computer. Nancy's got it.
Yeah, Nancy's got it. So I can't hear.
It might already be set up as Zoom.
It is on Zoom.
It is on Zoom already.
Yeah, so you'll meet in person, but you still have to log into the Zoom and start it so that members of the public can participate.
Yep.
If they choose to do so. So you'll have to record it still. But Nancy, you know how to do all that because that's what you were doing from home. So it's the same, but you just have to make sure everyone's on camera. So if you want to put it at like the head of the table and then turn the computer to face the table. What time is
do
your
that.
meeting?
10.
I can come over.
You guys will be our first
Okay.
hybrid model.
How many people have you talking about they're gonna be there?
8, I think.
8.
I think 8, Judy.
8 or 9, right?
Well, we need we're missing one board member, Mel.
Right. So
We have
that's
9 board members, but I
and
think we
then
only have 8 now. I'm pretty sure.
9, but you're the 9. Whatever. Okay.
So you'll be spacing 6
I
feet.
can't-
apart?
I think
I
we
hear
can.
you.
Yeah, if we set up the camera on like the coffee bar, I think we can work the 6 feet apart, Judy. I'll go in the morning.
Thanks, Mallory.
Problem.
Thank you, Mallory.
Anytime.
This is why Mallory is asked for at all public venues. Are you Mallory? No, I'm just with Mallory.
I'm Mel.
I want a statue when I'm done.
All right. There'll be a Wonder Woman statue, just so you know.
There we go.
All
All
right.
right, you guys are all set. Do you have any other questions?
No, I don't have
I
any.
don't think so.
Well, you know where to find me if you do.
Okay. We're gonna
You guys
move
have
on.
a great night.
Now, are you going to come to the meeting tomorrow to discuss this with us?
If you'd like me to, I can attend.
Okay, I guess I can leave. I would like that,
All right, it's a date.
just so we can ask you questions.
Ask away. All right, I'll be there.
Okay, thank you, hon.
You're
Thank you.
welcome.
Have a good night.
You too.
Night. See you tomorrow.
Have a good night.
Keep closing the agenda document, Mallory.
I have so many documents open and I'm trying to work off 2 computers, so I keep using the mouse for the wrong computer.
All right. So far.
So we're back. I guess, do you want to just continue with my update now for COVID-19? And then we can move to minutes.
Sure.
So I don't have anything too spectacular. We're following the state trend with the new variant. Our numbers are going up. We did have a small event, nothing major, at a group home that Sandy is watching and taking care of. Everyone that was in the group home has been tested, and whoever needs to be quarantined is being quarantined, and the employees that work there were also tested, and she's monitoring closely. Other than that, we had some excitement with our clinics that we're running next week with the Johnson & Johnson shot this morning. So we had between the 19th and the 22nd, 6,000 appointments set up. And I'm sure you all saw the news this morning that they are requesting a halt on the use of that shot due to 6 females between the ages of 18 and 35 developing a blood clotting disorder within 2 weeks of getting the vaccine, and actually one of them has passed away. So right now we're able to secure Pfizer, it sounds like, right, Judy?
Well, I haven't talked to Scott. I was working with some other volunteers when Scott called me this afternoon, and I haven't been able to get him in touch with him. But I'll have final plans tomorrow. FDA is supposed to be meeting tomorrow, CDC and all the other big folks, and figure it all out. It's 18 to 48, and I have my suspicions as to why. But we'll see what FDA and CDC, and that may actually put a real big dent in Johnson & Johnson's ability to provide vaccine. But anyway, yeah, they're going to have to go to Pfizer. Although, Rutland has the Johnson & Johnson sitting in their fridge.
I was going to ask that if it's already in the fridge. It's not been to thawed or anything yet, right?
No, they had the order in, and the state delivered the orders to everybody who had put an order in, and so they've got their delivery.
Yeah, this morning my phone was, as you can imagine, off the hook.
Yeah.
And it was hard because we didn't have answers. And then towards the afternoon, I had someone call and said that they got 8 emails from Rutland letting them know that they're still okay for their appointment. So I haven't heard from Seth or from Rich, but whatever is happening, they're making it work still. So we're lucky to be a part of that team. The work that those guys have done is just, I can't say enough about it.
I got 4, and I wasn't even supposed to be getting it.
I got some too. I'm like, why is my email getting it for at work? But someone must have popped in just my email when making their appointment or something. I don't know. But yeah, so, and Judy, you had asked about the registration. So I am available whenever I can. I'd be happy. Saturday.
I had talked with the team over there. We talked a little bit last Monday about trying to set up some pop-up clinics. We're supposed to be having a pop-up clinic for Country Hen, but I haven't heard anything more about that.
Okay.
They're supposed to be getting a list together, and then we'll have a date. And then the other thought that is like, I'm trying to find out if I have any volunteers who'd be willing to transport people, and I have a couple. And then I also have been exploring just having a registration day, and several of our volunteers know how to handle PrepMod. So I was thinking of just coming to the towns and setting up a Saturday morning and just saying, if you want to register and get signed up for Pfizer, then Valerie and I can get in behind the scenes and we can get them registered. Because a lot of them are having big problems trying to get. I mean, they're staying up till 2, 3 in the morning trying to get an appointment.
If you want to organize that, I'll show up with my Chromebook.
Yeah, we got Chromebooks. I mean, now I can do it in my sleep. I can ask some questions.
I know.
I don't even look at the screen anymore. So I would be, and I have over 100 vacation hours. So even if it wasn't on a Saturday, I'd take a day off and do it.
Yeah. And we were thinking of trying to get into these little towns, and although Hubbardston doesn't really qualify as a tiny town, it does still qualifies as a small town.
Yeah.
But, you know, we're thinking, I've got a call into Hardwick and New Braintree as well. So
Yeah.
we're going to try and reach out to, you know, all of the little towns and tiny towns in the area.
Perfect.
I have a question, Judy. Two questions, actually, one from Mallory too. So, what are you seeing relative to or hearing with the new strains and the effectiveness of the
Yeah. I
existing?
sent some slides over to Mallory. I don't know if she can pull up.
I read them, but I didn't get much out of that. Just to
Well,
be
actually,
clear.
I just wanted to concentrate on slide number 7.
Okay. That would have been helpful because I read the whole thing and I was like, this is Greek to me. So
No,
let me
I
send you a database schematic and then we'll trade. We'll trade things that we don't understand.
yeah. I tried to pull slide 7 out and just send that one, but it wouldn't work for me. So I ended up sending the whole set. But it's slide number 7 and the B1 that everybody's talking about. The good news is, although it is 50% more transmissible, the efficiency of all of the different vaccines on the market is only minimally affected. So they're going to be effective against the B1. So everybody needs to get vaccinated. The 2 that they're worried about is a variant of the B1 and another variant called P1. And the P1 especially, and then that you start losing the efficiency of the vaccines against it, and they remain more transmissible as well. They remain 50% more transmissible as well. If I remember right, I don't have the slides up in front of me, but
so there's 2 B1s, B1351 from South Africa.
That one is worrisome because we're losing some of the efficiency from the vaccines. I mean, it's still there, but not as well as folks would like to see it. So they're watching that closely right now. There are minimum numbers in Massachusetts. You know, we're talking.
The B1 from UK is becoming prevalent in Massachusetts.
That was becoming prevalent, yes. In Massachusetts, behind Michigan has the greatest number, but that's because Massachusetts looks high because it's artificial, because Massachusetts has been doing a lot of testing and looking for it. So that's why they're finding it, but they're keeping a real close eye on it. But right now, P1 and on that B1325, it is still pretty minimal in the state, but it's the efficacy of the vaccines that they're really concerned about. So they don't want to lose that, of course.
Interesting. So people still have to be vigilant.
Forever, yeah. Our numbers in town have gone up, but I think that's because of the outbreak at the home. And then
it is 18 to it's the 18 to 40-year-olds that are rising.
Yeah.
And people are worried. I know my own daughter-in-law is worried. She won't send her kids back to school because she thinks that the kids are going to pick it up in school. But right now, the kids are safer in school. The rate there is 0.7%. Schools all have air filtration systems that frequently turn the air over. Actually, it's the parents who are bringing it home. If you follow the cases like I do, it's the parents who are bringing it home to the kids, not the kids bringing it home to the parents.
Right. Or the teachers bringing it into the school. Or the teachers bringing it into the school. I know that in our district, I signed the girls up for pool testing. So they get tested twice a week.
Yeah.
Because there's been so few parents who signed up for it. My poor kids get a swab twice a week. But It's saved us because it's allergy season and they've been allowed back at school because they get
Right.
tested so frequently. They're not missing out. So
Yeah, and that's the thing too, is a lot of my patients are saying, well, at first I thought it was allergies, and then, it didn't go away. So, and it got worse, and I started running a fever, and then it dawned on them that it wasn't allergies at all. But
I've started working on
the other second thing is Walmart and other grocery stores. They're pretty dangerous places to be. And also birthday parties is another big one. That's what I'm hearing more and more. Oh, we thought it was safe to have a family gathering and have a birthday party, and then we end up trying to track down 15 cases.
Mhm.
So, again, we just can't let up on the vigilance.
and I've been working on a document to get out
I
on
have to
social
leave
media.
for a minute. I'll be right back, guys.
To get on social media. Is it allergies or is it COVID? So in between phone calls, I've been trying to get that out, but hopefully that will get out tomorrow.
Yeah, it's a good idea.
Slide 7, I have to learn how to translate the words on that. Okay. I was like,
We're all gonna be doctors when this is done. So
I hope
exciting.
not. That's not my gig. Let's see. If they had put it on a chart, I would have been fine.
You would-
Graph, I would have been good.
Well, it took me a while to sort it all out myself.
So my other question is from Mallory. So I don't think I received, so we had said when we did our vaccination clinic that people would get, within a few weeks, like a notification. Did those go out yet? Because I haven't seen one unless I deleted it.
If you should have gotten an email. You didn't get an email?
No.
Yeah, well, I sent out the ones that like asked me to do it at our clinic, and then you should have gotten like a congratulations, you're vaccinated email, and you can view your consent form.
Yeah,
At the
so
bottom of
maybe I did get that, right? But then I
Yeah.
couldn't do anything with it.
you should be able to print it, and at the bottom of your consent form, you'll have 2 consent forms, one for the 20th, one for the 13th. It will say who vaccinated you, all the lot numbers, which arm, all that good stuff. If you don't find it, let me know because I can look.
Well.
I've been looking them up like nuts. So
I will we'll let you know if I don't find it. I was
Yeah,
curious.
yeah, anybody that needs it, we can go in there and pull the record up and get it for you.
Yeah, and I assume we're going to get a bunch of those because more and more companies are starting to push for, your vaccine card, right? They want to
yeah,
know.
so your card acts as, I would suggest laminating your card and just keeping it in your wallet because it acts just as much as that consent form.
Yeah, I took a picture of it and put it on my phone.
Yeah, that's what I've been doing too. I saw a news article about it. Not that I've had to show it anywhere yet, but I'm ready.
There are some people there out there that are telling folks not to get it laminated because, because if you get a booster next year, they're going to use the backside of it. And I'm thinking, who's going to have it in their wallet by the time next year?
Yeah.
And you can always, a lot of boards of health, at least in this area, have gone with stickers because you need that. If you're going to vaccinate somebody, you need to put down the lot number anyway. So
Yeah.
the sticker will stick to laminated cards just as easily as a paper one.
Yep. Crazy times. All right. Anyone else have any questions about the COVID update before we move on? All right. Taking that as a no. And next on the agenda, if I can get back there.
Back to the minutes.
Back to the minutes. So we have to review the minutes for 2/9/21, 2/23/21, and 3/9/21.
And then hopefully I'll have the rest of them done for the next meeting. And then that girl can take over.
And I've read through them all. I did not see anything that jumped out at me as needing correction. I don't know if the rest of you
One
had.
small typo on one of
Oh.
them, but not significant to even worry about.
Okay.
It looked all right to me. I had to actually read them and remember.
And I had to rewatch the
It's like-
videos.
it's like, this was years ago.
So much has happened. Remember when we were all optimistic that we were gonna have our own clinics for a long time?
No.
You may want to correct the name of Sanda Barry. It's not, it's spelled Berry on the minutes.
Oh, okay.
It's Barry, and I believe it's only one R, B-A-R-Y.
Okay. I will look it up on the Park and Rec page and make sure it's correct before we post them.
All right. So
So I
do we
make
have
a motion that we approve the minutes from 2/9, 2/23, and 3/9/21 with the correction that Ben spoke of.
I'll second it.
all right, we have a second by Colleen. Ben,
Yes.
Colleen,
Yes.
Judy,
Yep,
Kathy,
Yes.
and Kate is a yes. So minutes are approved, motion passes. All right, so we did, now I have to skip around. We have no failed systems, no past 5. Water tests is the next on the agenda.
We got 2 in.
They look
one-
fine.
Yeah, there's nothing on them. So with the Hub House, Senior Center, and then 48 Gardner Road.
Yeah.
Okay.
I need to step away shortly, so may I speak new business out of
Yeah.
order, please?
Yeah, we can jump to the new business.
So Jim's health is declining, and I need to step down temporarily as chair of the board, and I would like Kate to step up for me at least till her term ends. So I make a motion that Kate become chair of the board from today to June 30th.
Second.
Okay. Take a vote on it. Colleen,
I agree. Yes.
okay. Judy,
that's fine.
Kathy,
Yep.
and Ben.
Yes.
All right.
Thanks, guys. I've looked over all the documents. The biggest, everything looks fine. I really did read everything this time. I will say that the letter regarding the mosquito spraying, because some of it's going to be aerial, I don't think that I like that idea. As a certified organic farm, that's not acceptable. So we have to submit in that document, in that 2-page letter, we need to submit to the state that we do not want to participate in their mosquito spraying for this year. It asks us to look for to provide an alternative, and alternative is no aerial, just from trucks or however they do it that way. That would be my recommendation. It's safer for people, and also people definitely need to be notified ahead of time that it's going to happen so they can keep their windows closed overnight when they do that. So that would be my suggestion, is that we do say that we don't want to go ahead with the state aerial spraying.
So the Board of Selectmen is actually going to hold a public hearing on this because they're looking for our input, and then they have to have a public
But
hearing.
it's under it's still a Board of Health issue.
Definitely. So what I'll
and
do is if
Public
everyone,
hearing or not, we have the final say.
so what I'll do is I'll put in writing our opinion
Yeah.
so they can read it into record on the 26th.
So I have a question. This aerials from planes,
Yeah. Or helicopters or something.
I didn't realize that they did that because of course, we all grew up with mosquito spraying every summer.
Yeah. And some of those products that were used back then are cancer causing. So I'm not
Yeah,
for that.
I'm sure it's a little, I don't know, safer just because they're a
I
little
don't
more
know. There's still some
cognizant
pretty
of
bad stuff.
the cancer risk. That would be good to
Call
get.
it aerial spraying back then, though. It was just a truck that went around the neighborhood, and
Right, yeah.
my
Yeah,
mother always
well,
made sure the windows were closed. And
And I can reach out to you and see what from the selectmen, because the letter doesn't say anything about aerial, so including aerial or other.
Yeah.
So they could very well just be doing
Well,
The
it
truck.
is
trucks
on-
here.
It's in one sentence on that 2-page
Yeah,
thing.
including aerial or other conducted by
Yeah,
the SRA
exactly.
MBC, yeah.
And where it's rural, they're
Yeah.
gonna do aerial because that's what they do.
Mm-hmm.
So that's my opinion on that in a nutshell. Everything else that you sent, I approve of.
Okay.
Well, I also think that if we are the ultimate say in this particular situation, that needs to be made clear to the select board.
Yes, please.
Not just so we don't get into confusion down the road and we get a little argument over who's in charge of this and who's in charge of that. But I agree with you, Kathy. You know, if it's the ultimate decision of the Board of Health, they may want to know that so that they can plan their public hearing with that type of information from us.
Right. They may want to frame the conversation with the public a little bit differently than.
That's right. And they may also not be aware that we have the ultimate decision, and therefore we don't want to step on toes if they get decidedly opposed to what we would like, and referees the jump ball type of thing. Just better to have it up front.
I would like to have a list of the products too, so we can just kind of, it's a good idea to have background, because the question's going to come up about, well, how risky it is it for cancer and all that stuff. So you're going to want a little bit of statistics behind all that.
Yep. Okay. If it comes up in the department head meeting tomorrow, when I make the announcement that Kate is taking over, I will bring those points up.
Yeah.
Okay.
Although
I
would. Okay.
One last meeting.
Sure. And I would note that in the letter, it does say that it's announcing the release of this opt-out process, which requires municipalities to secure approval to opt out via certified vote by the local select board or city council, and to submit an alternative mosquito management plan.
So if we're going to opt out, then we have to come up with that plan.
Yeah.
And I think we're probably, Kate, are you assuming, I'm assuming that we're going to be on the hook for it financially.
I would assume so, yeah. Yep.
I'll do a little more research to see if there's any communities that have opted out.
Yeah, and I'll try to do some research on what the products are that are being used.
So I found it. It's Anvil 10+10 ULV and the human health risk. So Anvil 10+10 ULV is a pesticide product that is used to control mosquitoes in outdoor living areas, including residential and recreational areas. There is, let's see, human health effects. So I found like the form on mass.gov, and I'll just forward it to everyone.
Okay.
So that everyone can read the product.
Because I deal with pesticides a lot.
Yeah.
Organic and non-organic. I might be able to give everyone some feedback from that.
Okay.
Thank you.
Yeah, sounds good. The other thing that I have noticed, living near a couple of swamps, we probably, if we're going to go with another option, we should look at what can be placed on the swamps, because that's where all the mosquitoes are coming from.
Mm-hmm.
They're horrendous over by where I live, and that's because over by Rieta Ranch there is a swamp area, and it's just loaded.
There are products that are all natural that are involved with the use of straw, which doesn't hurt anything, but I don't know how large of volumes they can be purchased in to be practical. So, so anyways, folks, I need to leave tonight. So thank you very much for everything. And I will be in on the meetings. I just may not be able to stay into them that long.
No worries.
Okay. Thanks, guys.
Good night, Kathy.
Kathy.
Okay. So I'm jumping around. I'm trying to figure out what we have next.
So we have the installer permit for Hackla.
Yep.
is next. And then we also last minute, before I could add it to the agenda, got a permit for baseball.
Oh, yeah, I saw that for the food inspection.
Yeah.
The residential, the snack shack.
The snack shack.
Oh, where's that gonna be? Is that gonna be up here in the rec field?
Yeah, it's in the rec field. I've actually inspected it before. It's
What do they
it's a
have?
con.
They have a grill.
They had a grill which was outdoors, right? So they, cook the things outside. Inside was, cold drinks, prepackaged snacks. That was it. I think they just do hot dogs on the grill, something like that.
I think
Um,
this year's application only said prepackaged food.
Yeah, they may not have a grill this year.
Interesting.
Typically, I
What
mean,
was there?
yeah, when I first joined the board, they did have a grill set up, and they, had a food safety manager, and they were cooking hot dogs and doing all that stuff. But I
Great.
think for the most part, it's prepackaged food. And I wouldn't be surprised if they just stuck with that this year.
Perfect.
And then on the hauler one, anybody have any questions on that one? Everything looks in place
He's
to
been
me.
a hauler in town for a long, long time.
Okay.
That's a
So I guess
septic hauler? Is that what that is? A septic hauler?
Kathy and I were just doing signatures for the chair was signing off on them. So do you want me just to send the permits over DocuSign?
Sure.
Oh, that's fine, yeah.
And remind me to the bottom of the agenda because I think we need a new vice chair because somebody else who's better at the rules of order should be running these meetings anyway, is what I'm saying.
I don't think historically we've had a vice chair. It's just been chair and members.
I don't know.
Did we vote you in as vice chair?
Yeah.
Just
did.
for you?
Vice chair and the clerk.
Yeah.
I don't know.
Okay.
I've only been on the board 3 years, but we always had a vice chair, and that person ran the meetings.
Fantastic.
I don't know why. I don't know.
Interesting. They never listed it like that on the website. That was a question I did have. So
I don't know.
good to know.
I think maybe it just happened organically. I have no idea.
Yeah. A lot of weird things happen.
Yeah, right. All right. So the next thing is inspections with Tim Newton. Do we have 2 scheduled?
Yeah, so he is completing lot 2 Ragged Hill.
Mhm.
He did the other ones. This lot didn't pass perk, so they're doing it. And then he is doing the Mount Jefferson ones, which are scheduled, I think, for next week. So
Okay.
he is amazing with all things septic involved. I mean, he lines everything up. He gets the forms pre-filled out. Even like the certificates of completion ready to go so that when they do pass, there's no trying to go back and forth with installers to get signatures and engineers to get signatures. So I think together, him and I have put together a super smooth process to get these types of things done. And I have had nothing but positive feedback from our installers and engineers on the work that he's been doing and his accessibility to them.
Mhm.
So.
Yep. Yeah, and I would agree. I've heard nothing but good things on all sides. And when we get to food inspections, we'll talk more about that. But yeah.
Yeah.
All right. So those 2 are scheduled, and then plans and review. We have 40 Healdville Road.
Is a new single family home that's coming to town. And then 0 Mayo Road was already approved plan for the pickets. Josh Therian, I want to say his last name is, has purchased the property and is looking to expand it by 2 bedrooms, so go from a 3 to a 5. So we had to start the whole process all over again for him. So Matt is having a hard time with that plan. I guess when the plan was drawn, they did not include everything that they should have, and they just referenced the first plan quite a bit. So he's been working with the engineer, but he's had that for over like a month now. He actually forgot about it for a bit. It was sitting on his desk. So he's trying to play catch up with that right now.
Is that the one that's currently being constructed at the end of Mayo?
No,
0
hasn't started yet.
So where's 0? It's just because it doesn't have a street number yet?
Yeah.
Okay.
Yeah. That's how they put it on their application.
Interesting.
Yeah.
I live on Mayo, so I'm like, I have no idea what that reference is.
The Pickets owned it and then they subdivided it.
I don't know.
I don't know how. I don't know the layout.
All right.
Yeah.
All right. New business. So we covered the RCAP solutions, and we covered mosquito spraying. So we were going to talk about Tim
Yeah.
in terms of
we-
inspections?
Yeah. So we're from my point of view inside the Board of Health Department, Tim is licensed and available to do all of our inspections for us. So including food, everything from perk to plan, review, install, everything. So he kind of asked me to come to the board along with us, already thinking that we would be doing this. And he's looking to take over plan review. He's having a hard time working off of someone else's approved plan. And where we weren't engineers before and we had Bill and Kathy doing the inspections and going out and looking at just how the system was laid and making sure everything was kind of copacetic looking. He is looking at the nitty gritty of the plans. And he just wants to kind of be what's the term, like start to finish, so that he is not having too many hands in the soup pot. So he is licensed to do reviews of plans. He's licensed for everything for a septic. So I understand where he's coming from, because right now he does the perk and then he has to wait. He's given us a turnaround time of 2 to 3 days on all plan review that he can get back to us. Right now we're waiting weeks. And then he'll have his own approved plan to do all the inspections for the multiple inspections for installation and completion. He's also agreed to take over and do all of our well and our building permit stuff. So he has the ability. I mean, Jen Susan Roy was already doing this, but she didn't have the certification. He does. So I feel comfortable giving my opinion of, yeah, we should have someone who knows what they're doing do the whole thing, so that we're not having too many hands in the pot and things get missing or messed up. And having one point of contact for me, who's accessible 24/7, a text message, a phone call, email. He hasn't taken more than 5 minutes to get back to me on any of them.
Right. And in terms of cost, so there's an inherent cost in having outside inspections and plan reviews in general. But if we streamline it under Tim, is there a cost savings because there's less people handling it?
Yeah, so he's right now is charging hourly. And then for the installs, he would just do the one fee. We already collect that fee. Right now it goes into the general fund. It had been moved from the general fund into a revolving fund so that we could pay Jen Susan Roy, and then Ryan came to us and asked us to start contributing again to the general fund because we weren't paying those inspectors. It was just Bill and Kathy that were going out to do so.
Yep.
But we can retract that and move forward with paying him from the revolving account.
Okay.
So,
And
Melanie, are you saying that we would have Tim do the reviews and not?
Yeah, Tim can do review. Tim can do any review that doesn't require upgrade approval. So we would still need Matt for those. But he's licensed to do all the reviews above
Does
and
Matt
beyond.
do those reviews now?
The upgrade approvals?
yes.
Yeah. Yeah.
Well, in my opinion, I don't mind when, as I understand it, Matt's gonna be retiring someday here pretty soon. When
Yeah, he had mentioned that last
retires,
year.
That's all well and good, but I mean, that man's been a dedicated servant to the town of Hubbardston for a long time. I would not be in favor of replacing him at this point. It's just not something I think I would be in favor of. I think if he's gonna make a decision and maybe retire, then we need somebody else. But until he does that, I think that the job is Matt, it's gonna stay as Matt. That would be my opinion for whatever he is willing to do.
Yeah, having talked to Matt about this last year when he was on, you guys can't even see me here, but he was on a vacation for a bit and had some leave where he was out of state. He seemed pretty okay with us bringing in outside help. I think he's at that point where he would be fine if we cut back what we put through to him. I'd be happy to have a conversation with him and have it be more of a conversation. But I think that moving to one person starting it and then seeing it through to inspection, it closes a lot of gaps and loopholes. It shortens the time period and it makes a seamless process. And I know when I joined the board, one of the things that we discussed with Ryan was trying to make the processes as simple, transparent, repeatable, and seamless as possible. So if we can do all that and we can do it, check all those boxes, and it's not going to increase any cost, then I think it's a good idea. I don't think Matt is going to take it personally, and I don't think that he's honestly going to care either way about the extra work.
When I started, we had already been doing this. Jen Susan Roy had taken over all plan review, and she was not licensed to do that.
Right.
So she was signing off on the plans that were going into the ground as unlicensed.
Who was down?
Jen Susan Roy. She had applied as a health inspector from Gardner to kind of help us do that, and she had stated that she was inspected for all those things, and it was not the case.
Yeah, she didn't have any of her certifications. So my first day on the job, I went to Ryan and was like, what are we doing? And why are we putting this liability on the town? And that's when I reached out to Matt, and Matt was like, oh, I just hadn't heard anything in a while, so I thought you guys were all set. And we really have only picked back up with the title or septic system reviews going back to Matt since I started. So he had like a year and a half of.
Yeah. That's what I said. Like when I started the board, he was like, yeah, I'm good. Like I think he's spending half the time away too. So he was like, if I can be up north, I'm fine.
That's a problem that we're running in with the Zero Mayo Road is that, right now the way that it works is we have like a courier box out, like a medical box. I stick a plan in, and then sometime over the night when he's done, it returns back to me with a signature. But that can take a long time, and the plan that I'd given for Mayo Road had kind of gotten stuck in the bottom of the pile and went missing, or not missing, but hasn't gotten touched, and now there's plans with it, and we have an upset customer because it's been with him for over a month now.
Gotcha.
Well, again, I'll go back to, the experience that I had over 30 years working with Matt and with his expertise and with his dedication to the town. So I'll move to table this discussion till we've had some feedback from Matt. I think that's a courtesy he deserves, and we can go from there. But I'm not in favor of just terminating his services.
I don't think we're not looking to terminate them completely though, because a lot of our stuff does require the upgrade approval because of all the water.
Well, that's the motion on the floor.
Okay.
Do we have a second on the motion?
I second it.
Okay, Colleen?
Fine. Okay.
Ben?
Yes.
Judy?
No.
And I am a no, because I really think we should just move forward. And basically what we're moving forward with is the plan to have an inspector to take over the slack from Matt, which is the same thing we did a year and a half ago with Susan Roy, but it didn't work out because she had misrepresented herself. So I'm a no. Still passes. We'll have a conversation with Matt. Can we invite him to the next meeting,
Sure.
Mallory? So it's a public conversation.
Good idea.
And then at that time we can potentially re-entertain. But when we discussed it with him previously, he was literally like, yeah, like I'm good.
Well, and he also mentioned that all of that everything that he wants moving forward when he goes to Maine is going to be, when he retires, he's going to Maine, it's going to have to be PDF digital. So we wouldn't even have signed copies in the files.
Yeah, which is a problem, but okay, so we'll table it. And there's a piece of this we need to separate and spin off. So go back 1 second. So we've tabled Tim Newton as, end to end for building permit approval. I would like to put it forward a motion that we use him for food inspections. I quite literally cannot keep up with them because of my work schedule as of recently. And, from a personal perspective, my work, there are 4 people furloughed whose jobs are now mine. So I already had 2 very distinct roles in my company, and now I'm juggling like 6. So
my world.
yeah, 60 to 70 hours a week is typical for me. So trying to, take off for a couple hours in the middle of the day to go do a health inspection is really difficult. I went with Tim to the Hub Diner, and I asked him to do that one with me specifically because of some, conflicts that we've had with the particular personalities, I guess. I didn't want to repeat that. He was very professional. He handled it incredibly well. He cited a couple of minor violations, one critical one that he followed back up with them on. I introduced him to other people in that plaza so we could kind of go and schedule others together. We scheduled one today that I actually had to miss, but rather than cancel last minute on the business owner, I had Tim go in my stead. And I recommend that we have him move forward with kitchen inspections. I'm the only person right now who's food certified on the board. So if I can't get them done by June, they're not going to get done. So I make a motion that we move forward with using Tim for kitchen inspections.
So moved.
Hey,
So we have
so you want to include well inspections and sign offs and that too. Kathy was signing off on them.
Yep.
I don't know how well versed you are in the code for wells.
I'm
I
not,
believe
but
that's troubles.
we had already approved that previously.
Oh, we have, okay.
Yep. We had approved him taking over for the well for Kathy, I believe
Perfect.
several meetings ago. And then what we hadn't decided on was kitchens.
Cool.
So this motion is specific to that.
Can we also add, sorry, for any septic and well abandonment for right now too? If someone wants to abandon a well or a septic system, that he handle that. It doesn't require a certified plan to be reviewed by Matt, but someone who is licensed needs to approve it.
All right. So I'll amend my motion.
Thank you.
I make a motion that we employ Tim Newton to inspect wells, abandoned wells, and in addition to his current septic Title V, not plan reviews, but inspections, and residential and non-residential kitchens. All right.
So
Can I get a second? Ben's a second. He keeps saying so moved.
Well,
Get tired.
you mentioned a minute ago about parliamentary procedure, and by parliamentary procedure, the chair is not allowed to make a motion.
Oh,
Can
there you go.
entertain motions, but they can't make the motions, which is why I say it the way I say it, so that
Got it.
I'll move that question as you mentioned, and we can then entertain a second on it. But you know, if you want
Got it.
nothing wrong with it. It just has to come
I got
in
it.
a different direction.
So good. All right. Can I get a second on the movement?
Okay, I'll second it.
All right. Vote from the top, Judy,
Yep.
Colleen,
Yes.
Ben,
Yes.
and Kate's a yes. And I am curious to see some of the inspection reports though, Mallory, because I want to make sure. So one of the other things, I'm jumping ahead since we're already discussing kitchen inspections. I'm going to jump ahead on this to food inspections so we can kind of tie it up. But one of the things that happens on the food inspections often are follow-ups. So not tonight, but I think sometime in the near future, I would like to review what we charge for permitting, how much inspections cost, and whether or not we want to employ a system that says, we follow up, we come back, we do a check, we say, did you fix this problem? After the second or say even the third follow-up, if we have to continually follow up with the same issues, that we charge the business owner for the re-inspections. So we do a full inspection plus at least one follow-up, and then we kind of look at financially where that leaves us. Because if we're paying somebody to do these inspections and they have to follow up 3 and 4 times, we'll be losing money as a board. We'll be paying a lot out of pocket for these inspections that we don't today.
I actually, Kate, have started that project, and I'm just gonna put a presentation together for the next meeting.
Awesome. It is something that is done in other towns
Yeah.
where the permitting process includes like a reinspection. And
Yeah.
then beyond that, the business owner has to basically pay and send in a check before they can be scheduled and released on the next inspection. And if they don't, they're shut down.
It's the same with building permits. If you fail,
Yep.
you pay to be re-inspected, and once we get that check, we'll re-inspect you. But if we don't get it, then you get a cease and desist order.
So
Not
it's something we'll bring up on a future agenda, but it's something that has been bothersome.
very.
All right, so we have covered everything under new business. Open complaints. We
So
have
just
111
have
Gardner Road.
2 are on hold. 248 Gardner Road has been brought to the selectmen's attention. So the selectmen are going to start looking at putting together. I met with David Nixon, and he's going to start looking at putting together a of representatives from all boards to address, because there's multiple boards involved in violations on that property. So stay tuned, because that's coming from down the pike.
Okay. And old business finance reports.
Yeah, so I just have this afternoon, I didn't get a chance to attach it. I turned over $343 from the recycle day. And then I have the invoice for Tim Newton for his March that we have to approve.
And the invoice for Tim Newton, I do have open somewhere. And the total due was $370.
Yep, $370, and everything was in line.
I'll entertain a motion to approve that if somebody wants to put one forward.
So moved.
Can I get a second?
I second it.
All right. Colleen,
Yes.
Ben,
Yes.
Judy,
Yes,
and Kate is a yes. Motion passes and the invoice will be paid. I'm trying to read the bottom of it. Talked about food inspections.
Yes,
Oh, go ahead.
Tim completed the market today, so there was just a couple small violations, and he'll be back out on the 27th to ensure that they're corrected.
Okay.
Which place was that, Melanie?
The hub market,
That
Family
was one.
Market or?
next to Giacomo's, not Mr. Mike's, but the one next to Giacomo's
Okay,
in that plaza.
thank you.
Yeah, I was supposed to go with him on that one, and it was not my day. Ask me about Johnson and Johnson. Just saying. Anyway, recycle center. So Mallory and I volunteered and ran the recycle center on the first opening day, and we had a lot of people come through with very little advertising. We were very surprised.
Yeah.
We also have looked at the way it's laid out, all of the kind of accumulated mattresses that have been dropped over the winter from DPW and other people probably dumping them. The scrap metal container, which is full, the battery shed, which is full, the electronics shed, which is full and falling apart. The free cycle shed in the back, which is to get to, has trip hazards. It's full of vermin and raccoons and spiders and rats, and is falling apart. Quite literally, I don't think it's structurally sound. I don't think we should allow the public in it anymore, other than to maybe get some volunteers to empty it and then have it removed. I have the workings of a plan. I've started a Google Doc, and I'm going to send it to Mallory to review. But basically, if I can open it, what I would like to see happen with the recycle center. I mean, obviously we have an open rec and we have somebody we're looking to hire. That person is still going to need a lot of support. We, at a minimum, need to empty the scrap metal and have that
I've already
taken.
called for that.
Yep. We are looking at taking away, any other scrap from appliances and bicycles. There's somebody in town that rehabs bicycles and takes them. But it just appears there was a lot that was collected there, but not necessarily recycled. And there's some structural issues with the sheds that exist. There are 2 wooden sheds, one that has an oil tank in it, an antifreeze tank, and batteries. Then there's a shed that has a plethora of just stuff and a small office. where we had attached and put in electricity. And I think as a board, I think we should actually go and take a walk around, but so we can kind of walk through this plan and explain it. But we both agree, Mallory and I, just in talking it through, it would be so much better if the area were cleared, meaning right now there's a shed. There's a shed along the back, one next to it. Then there's a scrap metal shed to the right. There's a shed in the front. And then in the middle of the whole mess is a pile of mattresses. So there's no way when somebody drives in that they could back up to the appropriate place to unload quickly and safely. And the ground is unlevel and there's rocks and dirt and sand and trash. So we'd like to organize some volunteers, go through, clean everything up, kind of do a site inspection as a group and look at it. And then consider removing one of the sheds, maintaining the electricity, and putting in containers so that traffic can come in, somebody can meet them, and then have them back up to the appropriate shed. And a volunteer can help them unload to that shed. The way it happens now is people are parking hundreds of yards away potentially, or backing up around obstacles, and it's not safe. You're hauling further. It's difficult. So I'd like to just rethink the way it's laid out, clean it up, start fresh, and then whoever is hired can help with that effort and or benefit from it and kind of just move it forward. So we'll put together more of a formal plan on that, but that's kind of where we're at and what we discovered. And Mallory's been doing a ton of work trying to find vendors to take all of the things that are just there.
Well, I think we definitely need to do something about that situation. And I mentioned to Mallory and Kathy that we may also want to, if we don't find somebody to take the job and run the recycle center, we may also want to talk about maybe using other facilities and what am I trying to say? What's the word I'm looking for?
Something station,
Excuse me?
something station. I can't remember the first word either.
Not transfer, but using another community as
Yeah.
like they do with my goodness, I'm at a loss for the term. They use the same thing with the dispatch. We regionalized. Sorry,
Yes.
that's the word, regionalized. Yeah. And you know, there may be other places that would make more sense. And the last thing I wanted to know is, are we still in possession of the generator? Is that still
Yep.
there? Oh, good.
Still there. Yeah. Still there, and it's in the office shed. So to give you a sense of how deep the hoard is in that shed, Mallory and I spent the entire day in between people showing up with donations and writing out slips, and we cleaned off a corner, just a corner of that area where there was a table at the entranceway. And it was a table piled with things. There was stuff under it, there's stuff behind it. Behind that, there are electronics that are stored in there, these huge TVs that I can't move that are just there. The electronics shed is full and filling up more, but the shelves in it that were built to house the TVs have collapsed. So they weren't built well enough and they've just fallen. So there's just these trailers and containers filled with things that have never left, right? So even if we do go to a regionalized group, like we go regionalized, which I'm totally for, let's look into that. If that makes sense, great. Even if we do that, all of this stuff needs to be moved out of there. So that first step of the plan has to be executed anyway at some point.
Can we touch base with that group that the Boy Scouts use for their waste recycling?
For the electronics and TVs.
Yeah.
They actually had said that they were going to stop by and take things from us because they get a bulk, and we were like, fine, if it's a win-win, and they did not. So I don't know, Mallory, if you rejoined or if they've contacted you.
Yeah, the whole recycling thing has always been an iffy proposition from the get-go. Everybody, the state wants everything recycled, and their push for everybody to be 80% recycler, but then, you know, the markets dry up, they come and they go.
Yeah.
You know?
Yeah, well, and certain things get specialized to the point where, you know, you'll have somebody who will recycle appliances, but only the panels, and then the electronics within it go to a different recycler.
Right.
And so, yeah, there's a lot of and, you know, whether we go regional or not, it requires a certain level of expertise and having, you know, your hand on the pulse of that industry to know
Mhm.
exactly what to do with every single type of recycling, you know,
Yeah.
item.
Yep.
And
Good job.
yeah, another mention on that is Hubbardston Cleanup Day is this coming weekend. I've heard nothing about it, but people have asked me about it. I was like, go to the website. It's a public group. I don't know what to tell you. I tried to coordinate with those folks last year to see if the board could work in tandem with them. And then COVID kind of happened and they just did their own thing. So I don't know if you guys hear anything.
Well, they're on Facebook. If you go to the Hubbardston Celebration, they
Yeah.
have a thing right on there. And I think that if anybody's on Facebook that follows any of these Hubbardston groups, it's right there. There's signs all over town about
Yep.
it.
But
So,
it's a public group.
it's
I think
how-
it's a shame that I've never gotten to the point where we could work as a board with these groups and like do
Yeah.
something concerted. So it is what it is.
But I don't know why they were all asking, you know, what's going on when
Yeah.
all the information's right there, you know,
Yeah.
and it's on the signs.
Yep.
It's like get a bag and pick up trash.
Right.
And bring
Yeah,
things
last
to
Earth Day.
Brookfield. How hard is that to figure out?
Yeah, I think I was cutting down trees on trails. Mallory, do you have anything to add about the recycle center?
I missed what you said, but I'm sure that you touched on all areas.
Gotcha. I know you also logged in as Ryan McLean, or is that Ryan McLean?
No, that's me. I don't. My Chromebook went into like an update, and then I logged into the home computer, which doesn't have audio or a camera.
Right.
So I logged onto my phone. So because we also don't have speakers, apparently I couldn't hear it. So
Gotcha.
it's me.
All right. So that is the update on the recycle center. More to come on that because
Oh, one thing. Could we? Is it okay for us to get the dumpster down there so that we can start hauling out the trash? I think it was $451 for a 25-yard dumpster for a week. So we just have to coordinate with volunteers to have everyone meet down so we can just haul as much into the dumpster as possible and get rid of it then. And that covers for 4,000 pounds of trash. And then $60 per thousand over that. And her account after the recycling account after our deposit this week has almost $6,000 in it. So
gotcha. And that 4,000 pounds of trash, is that going to allow us to include some of those mattresses or no?
no, mattresses are $55 a piece. So I've been working, hopefully we'll be able to have Travis load them up and take them to the center in Gardner, which charges $20 a piece. But I'm still waiting for because I think we'll have more than enough just to cover those 20, but the longer they sit, the more infested and gross they're going to get. So,
right.
And they will take bulk. So not at a specialized rate, but they'll take them.
Gotcha. And the 451 for the week for that one dumpster, can we wait and coordinate it with the volunteers, or is it, we have to take it a certain week because they're scarce?
They're scarce, but he said as long as he has at least a week ahead, he should be able to obtain one for us. And that's D&I at a Gardner. Their rates are like far more affordable than anyone else that I've contacted.
Okay.
So who's gonna fill it? Are those the volunteers you're thinking about?
Mhm.
Yeah.
Yeah. Young
Travis?
volunteers, young, keyword is young.
Travis mentioned that he can use his equipment to load anything that we needed loaded. So I know there's some furniture down there that needs to go in that we can't just pick up and haul, but a lot of it is going to be trash bags because Kate and I started cleaning out the front office and it's literally just
like 4 trash bags of just trash on the floor.
Trash, newspapers and nails and cards, and it's just trash.
Mm-hmm.
Yep. I know we probably have about 15 bags worth of plastic oil containers that we can get rid of, and then we just got to figure out tires and stuff.
I don't have a solution because clearly it's difficult to get people to do some of these jobs. But I think being the Board of Health, it's not something we can continue to tolerate, having vermin and all the other
Mhm.
A
pests
little,
down there. I think we need to do that as soon as we can, just to, if nothing else, set an example.
Yep.
But, you know, it's
I
something, and it may be expensive, but I think we gotta get rid of that stuff. I didn't realize it was that extensive.
It
Yeah.
is extensive. So
Yeah,
the
it's
first,
not
the
right to let that sit there. And, you know,
Yeah,
we're-
so the first step is this trash container to get all of the trash we can out with a group of volunteers. So that's the,
correct, but would it be prudent to hire somebody like one of the haulers that we have in town, of Waste Management or Harvey, to get in there and just get rid of it? I know it's gonna be expensive, but, you know, like I said, we're the Board of Health. We can't just let this happen like this. This is time to get this thing over with. It's
Mhm.
an intolerable situation as far as I'm concerned, especially when we have two other items on our agenda that we've been looking at, saying similar issues involved. So I'll make the motion that we get a private hauler in there to just get rid of it. I'm cognizant of the cost, but at least we can get an estimate. How's that? Let's get an estimate on getting rid of it so we can discuss it at the next meeting.
Sure.
And by that, I mean everything. What Travis can help us with and put into the dumpster is great, but the stuff that nobody wants to touch or should touch needs to be taken by a professional and gotten rid of.
right.
Um,
So can we check with the private haulers and like an outside, like 1-800-GOT-JUNK is like a comparative?
Yeah, I'll have to start taking a look, see what's out there, because we're gonna need multiple services. Not everyone's gonna take the tires. Not everyone's gonna take the trash. Not everyone's gonna take the copious amounts of scrap that needs to be taken apart. There's probably Kate, like at least 50 bikes down there.
Mhm.
Electronics, batteries. So it's going to be piecemeal together. I don't think there's any company that's just going to do it all together. So I'll have to start taking a look at.
Yeah,
All
I think Mallory's right. And we can't do it just all in one weekend. It's not gonna work.
No.
It's all gonna have to be piecemeal and there's gonna have to be, and Kate's right, there has to be, there's a step 1 and there's a step 2 and a step 3, so.
I think definitely step 1 is the trash and the piles
Yeah.
that are out. And then we can start moving towards the tires and there's corroded batteries that we need to get out of there. And there's the electronics trailer is a trailer that's literally just been shoved full of electronics. So that's probably the lowest priority right now, but I don't know how long they can just sit there because the trailer's already falling apart from the weight of the items in it.
Mhm.
So it was suggested that we all take a walk around, and I said, I agree with that too.
Okay.
Sure.
Me too.
Yeah.
Definitely.
Oh,
What are you guys doing on Saturday?
Yeah. I knew that was coming.
Well, let me look at my little book here.
I have appointments till probably 2 o'clock, but
How about Friday morning? I'm open Friday morning.
I have a clinic.
I'm free Friday and Saturday.
Saturday's better.
Saturday, and then you had appointments Saturday mornings. You want to do the afternoon?
I'll be back in town about 2 o'clock on Saturday.
Well, it'll probably only take about half an hour.
Well, I don't mind going down there and walking around on my own, so.
Okay.
Oh,
If
yeah.
you're on schedule without me at a different time,
But-
I'll just take a ride down there. That's not an issue.
Yeah.
But you need keys to get in the sheds to actually see the extent of the lunacy.
And who has the keys, Mallory?
Mallory.
All right, so I'll pick up the keys. Not a big deal.
All right. So so what time Judy and Colleen on Saturday works for
It
you?
doesn't matter to me.
Yeah, it doesn't matter to me.
All right. Let's say 9 a.m.
Oh, geez.
All right. We'll say 10 a.m. because Judy likes to sleep in.
Let's do 10.
Yeah.
All right. And Mallory, if I need to, I can swing by and get the keys from you whenever you tell me what works for you.
I'm there. So whenever you're wanting to, or I can leave them out in the hall and give you the code to punch in if you just want to pick them up on your way Saturday.
Saturday, 10 a.m. if you want to meet us there. And if not, shoot me an email and give me directions on where to find the keys. It'll be like a scavenger hunt.
Woo!
Should we bring some gloves and some boots and stuff? And
I don't
Gloves,
yeah.
probably not boots.
because are you gonna,
I
Are we
wouldn't
gonna
wear
do-
open-toed shoes because you might get a mouse
Oh.
across your toe, but
No, I mean, is this just a walkthrough? Or
yeah, we're just gonna,
Yeah,
Just
you're
gonna-
not working.
Nothing.
it's not open. We're just gonna take a walk around.
All right, okay, because I would gladly bring, go down and,
Make sure, I would say, make sure you have a mask for, especially if you're planning on exploring inside the free shed, and the main shed that was being used as an office. You want to protect your lungs, because I was not smart for the whole day and took my mask off a couple times and had some serious repercussions on Sunday.
oh, wow.
Yeah.
So.
Yeah, it's like, hantavirus special.
Mm-hmm.
Yeah.
Oh, lovely.
Yeah.
Yeah.
Tarantulas ain't got nothing on this place.
We were
Great.
stepping up off of to the top of a table, and I'm like, "Oh, look, Kate, it's half of a mouse."
Yeah, there was like a,
That's not even funny, the haunted
Hind
virus.
leg.
That's a terrible thing.
I know, but there was legitimately like a piece of a mouse skeleton. And we were like, whoa.
Just leave
Yes.
it in the bag.
Yeah, we had Lysol wipes, masks. Anyway,
We
that's
have
all-
places, trash haulers in town that, that's their job, to take the trash, and if that place is nothing but trash, why don't we just get them in there and get it out? Either Harvey or Republic or whomever.
yeah,
we-
but it's not that simple then. It's like there's layers of trash with layers of electronics and stuff they don't take. So they're not going to
mixed
dig
up?
through it.
They're all mixed up.
They're all mixed up.
Tell them to take the electronics too, take it all.
Shove it
Yeah.
where you fit, pretty much. If it fits
Yep.
into the shipping container.
So, all right. So we have at least an action plan. We'll meet on Saturday. We'll get some additional estimates and we'll bring it back to the next meeting.
Yep.
Any unexpected subjects? Oh, actually, I know we have an unexpected subject. Can we appoint somebody as a vice chair who's really good at Robert's Rules of Order? Can we do
Vin.
that? Vin?
Vin.
What is that?
Very well.
So Vin accepted the nomination. Anybody want to put a motion out there in a second?
I'll do that.
All right. We all in favor, Judy? Judy's on mute, but she's smiling.
All right.
All right, Colleen,
Yes.
I'm definitely in favor. Vin,
Sure.
you're vice chair. And you take over the meetings from now on because I suck
You
at it.
want me to run the meeting?
Yes,
Okay.
please.
Okay.
Vin, your term is up. Are you planning on rerunning, or should we start looking for 2 people?
I'm undecided yet, but I have no objection if you want to look for new people.
What the heck? You're not having fun?
Well, I'm thinking 27 years of service to the town, I may be on the downward slope here. I might want to
Yeah,
go fishing a little bit more, but
I don't. You know.
I'm not sure. But I'll make a decision in the next week anyway.
Okay, I'll just keep my ear to the ground for anyone that may be interested.
We found a few people during the recycle center day that were like, hey, one guy actually asked about volunteering. And I was like, you can volunteer for the Board of Health.
Yeah,
On
absolutely.
Club Day, and I was like, the Board of Health is really cool.
It is cool. All right. Any other unexpected subjects?
We're cool.
We are cool. All right. I'll take a motion to adjourn.
So moved.
So moved. Aye, aye, aye.
Hi.